Hello, everyone, and welcome to our 2025 PKD Summit. My name is Michelle Goodfellow, and I'm the Communications and Engagement Manager for the PKD Foundation of Canada, which is the only national organization solely dedicated to fighting PKD through research, advocacy and awareness, and education and support. This session is a presentation by Registered Psychotherapist qualifying Joy Pekar and talking about living with uncertainty when you have PKD. We will have a live question and answer period at the end of the event if you'd like to put your questions in the Q&A area or in the chat. And this session is being recorded and we'll have it available to view on our YouTube channel in the coming weeks. So now I'll introduce Joy, although by this point, I don't know that Joy needs much introduction to our community. Joy is a registered psychotherapist qualifying whose professional practice is shaped by personal experience. Joy's family has been directly impacted by polycystic kidney disease. It's a journey that has included searching for a kidney donor and navigating the emotional complexities of dialysis and transplant. With this deep understanding, Joy helps individuals and families cope with the emotional toll of chronic illness, particularly kidney disease, offering compassionate support and mental wellness strategies. So welcome, Joy, and I think I will just hand the presentation over to you now.
Thank you so much. I'm always so flattered by that lovely introduction. And I'm always so thrilled to be here. This is a group that I have been, an organization I've been a part of for many years, and it is such an honor to now be able to share my story and my professional knowledge in this way. So thank you for inviting me and including me. I'm going to share the screen. Make sure I've got that the way that it should be. And I trust that if there are any problems with the screen share, that Michelle will pop in and let me know. So today we are going to be talking about mental health, but most specifically living with the uncertainty or the unknowns that come with polycystic kidney disease. As Michelle shared, I'm Joy. I am a registered psychotherapist qualifying, and there are lots and lots of people with that same designation as me here in Ontario and in Canada. And what brings me to the conversation is not just my credentials, but also my lived experience with PKD being a part of my family and my story. If you've seen me before or heard me before, you may wonder if I'm recycling some of my old content, and I wanted to let you know that I acknowledge that, and I make a very concerted effort to make sure that the conversation today feels really different than ones we've had in the past. Um, Uncertainty really focuses on your relationship with your future. And so that is really where we're going to center our conversation today. But there are bits of my story that I'm sure you might have heard before, or certain aspects that might connect to previous presentations. And, you know, I think that's normal and to be expected. Mental health is a broad topic and we can look at it from a lot of different ways. So I hope that you feel like you come out today, even if you've heard me before, with new thoughts, new ideas, new perspective, and particularly around how that connects to the uncertainty that comes in the future. Our main goals for today are to address the uncertainty, talk about what it can look like, what it can feel like, the emotional impact of that uncertainty, and to talk about how you might consider coping with it. Because it's a thing that exists. We can't take that away. We can't make PKD any more reliable than it is. When we talk about uncertainty in PKD, that can mean different things for different people and at different stages within your disease. You might ask yourself questions about the future like, will my kidneys fail? Will my children be okay? Will I get a transplant? Will I need dialysis? What if I can't work? How will my family cope? All of these questions and so many more, they're huge questions. I rhyme them off like they're nothing, but they are huge and they are life-changing, each and every one of them. I wanted to share some photos of my own life and my own story. Having been married to somebody who has polycystic kidney disease, inherited from his mother, Um, and as Michelle shared, that our journey included those questions of will he need dialysis and how will that impact our lives? How will it impact our family, our growing family? I understand that you just had a session on families that are growing and decisions that you can make around that. And those are certainly things that were very front of mind for us at that stage of our lives. Um, we had big decisions to make when it came time for dialysis. Uh, what kind of machine, what kind of dialysis? Does hemodialysis make sense? Does peritoneal dialysis make sense? Do we want to work towards a transplant, a living kidney donor transplant versus a deceased donor transplant? There are so many choices, but even beyond the choices, even when you make choices, there's so much that is still uncertain and outside of your control. When will you actually need to start dialysis? Will you need to start it at all? Could you have a transplant preemptively? Um, will the transplant be successful? What if it fails? What if you get an infection? What if you get COVID? Oh my goodness, that just threw a wrench into all of our lives. And even if you think you can anticipate every possible question or uncertainty that exists, life will throw you more of them that you hadn't considered. Walk into dialysis one day and oh my goodness, now you've got a blood clot and your access isn't working. So there's just this constant awareness that things in the future aren't as clear as you thought they might be. I should say, sometimes, especially in this part of a session, it can feel like a lot of doom and gloom, where I drop a lot of truth bombs and I'm like, and this is a thing that's hard, and this is a thing that's hard. And the reason I do that is not because I want to scare you, but more because I want to acknowledge that these things are real and that you may be experiencing some or many or even all of them, and to share that I've also experienced some or many or all of them. Um, I think there's a big difference between doom and gloom versus acknowledging the reality of how hard this can be for many people. And so, if this part of the presentation makes you feel understood in terms of what you are facing, or what you have faced, or what you are worried you may face, um, then I want to acknowledge that because those concerns are real. And I also want to give you some hope that it's not going to be all doom and gloom for the whole time I'm here. We're going to talk about a lot of aspects that can bring hope into the equation of uncertainty. Okay. If you've seen me before, you've probably seen this slide before because I think it is so important to say my story is my story and your story is your story. So when you hear my story, if you hear things that really resonate with you and say, oh yeah, that's familiar, I can really connect with that. But then there's also elements of it that you don't connect with, and that's normal because each person is different. How PKD impacts you, how uncertainty impacts you, how your life changes and your medical changes impact you have to do with the whole story of who you are, not just the fact that we share the aspect of PKD in our lives. Your age, your gender, the stage of your illness, your race, your culture, and so many other elements intersect to create you as a whole person. And so I just want to acknowledge that each person is here with their own story and their own experiences. One of the biggest uncertainties I find with PKD is the timeline, that we try to imagine what our future, what our life might look like. And PKD makes that really hard because its progression is very um, uncertain and very variable. There's some people who reach kidney failure in their 30s and others who don't reach kidney failure until their 50s, 60s, 70s, or even later, or some people not at all. And so having this diagnosis does give you information, but it also gives you this huge amount of uncertainty um, around the timeline of how that's going to impact your life. So the disease itself, in terms of its progression, is very unpredictable. How your symptoms will change is very unpredictable. Some people experience a lot of pain very early on, where other people don't have pain as a key or major part of their illness. Um, there could be a lot of uncertainty in terms of treatment path, and I want to link the idea of the future being the biggest uncertainty of all, or the most prevalent. And that's where we really see the impact on mental health. When your thoughts about the future come into the present, that's normal. Of course, it's normal. You have a life-changing genetic condition, and you are going to think about the future, and you're going to think about that right now. It's the reality of what you live with. And I don't want to come and say that that's a bad thing. It's not a bad thing. It's a completely normal and expected thing. Um, but it can have a big impact on you emotionally. It can have an impact on you physically. It can have an impact on your family. Um, the worries that you experience today about the future are impacting you today. And it is not my goal to make those worries go away, but it is my goal to perhaps show you some strategies to make those worries feel a little more manageable and allow you to live your life today in unison with the uncertainty in the future. A lot of people might refer to that uncertainty about the future from a medical perspective as medical anxiety. And I did want to bring up the topic of medical anxiety because anxiety sounds like a very pathologized or clinical term. And in a broad sense, medical anxiety means worrying about health. But at the same time, anxiety refers to a worry that is disproportionate to the actual amount of risk that exists. So if your worries are so big and they don't align with the nature of what you're currently experiencing, doctors might describe that as medical anxiety. I have to tell you, it's a term that is a huge pet peeve of mine because so often, very, 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 very often, I meet people who have had interactions with healthcare professionals who said, I think you're being anxious about this. And it turns out that their medical situation was more serious than the healthcare professionals realized at the time. So I will never, ever, ever approach someone's worries about their health in a pathological way. I will never approach someone's worries about their health and saying that it's invalid or disproportionate. Um, I just think that the picture is so much bigger than that. And I worry very much that when we say you're worrying about this too much, it's anxiety. Have you tried CBT? Is one that I hear a lot from healthcare professionals. I worry that we can fall into what we might refer to as medical gaslighting. Oh, I'm not going to ever tell you don't worry about that symptom. There are lots of other things we can do instead of giving you that messaging. All right. I also want to acknowledge that the feelings that we have around uncertainty are not just the ones that we have uncertainty about medical symptoms or medical questions. We can also be really uncertain about so many other things, like our families. How is this going to impact my family? I'm worried about how my family will manage as my disease progressions, as symptoms change. I'm worried about my caregiver. I'm worried about my spouse, my parents, my children, my siblings. One thing that is not talked about nearly enough is the impact of a chronic health condition on finances. Um, there are suddenly new financial requirements or financial responsibilities that may come up for you, especially if where you live is not very close to a hospital that is able to treat you at your stage of illness. Then you can have, there are some ways to get some of those things covered, but there are definitely financial costs associated with illness that aren't covered. Sorry, going back to the last point as well, a lot of people are impacted professionally by their PKD, which is, of course, a huge, huge financial implication. Travel is something that I hear about a lot. And on the one hand, travel is something we see as a luxury. On the other hand, it is something that we see as part of life. And it's not impossible to travel after transplant. It's certainly not impossible to travel if you're on dialysis, but it is a lot more complicated. And so, if that's something that's a really big part of your life, then as you move through different stages of your illness, you may be thinking a lot about the uncertainty of your ability to travel. I often hear people say, I want to travel while I can. And this picture is a little bit silly, but it gets to the point that we also have uncertainty about our emotions. I don't know how I'm going to feel. I don't know how I'm going to feel about being at the next stage. I don't know how I'm going to feel about changing symptoms, about changing relationships, about changing physical abilities, if that is something that is coming up for you. I don't know how I'm going to feel about my changing body. I hear so much about the impact that people have as a result of their PKD belly and how that is impacting their emotions. So, all this to say that the uncertainty is not just medical, the uncertainty permeates into many aspects of life. So, enough with the doom and gloom. Let's talk about what we can do because we know that certain things are outside of your control. The fact that PKD exists, the fact that your disease is going to progress in the way that it is happening. There's so much that you can't control. Um, and I do want to take a small amount of time to talk about, coping strategies sometimes are really helpful, sometimes might be unhelpful, and sometimes might actually be unhealthy. And so I want to speak very briefly within all three of those categories. I am not going to define what is and is not an unhealthy coping strategy for you. It is not my place to do that. Only you know what is or is not an unhealthy coping strategy for you. One thing I would invite you to consider is to ask yourself if the coping strategy that you're using is aligning with your values. So if the way that you are coping feels good for you and aligns with your values, then it's probably an okay coping strategy for you. Sometimes I talk to clients and they're like, yeah, I binge watched like 8 hours of TV yesterday. I'm like, okay. And then I felt calmer. Okay, well then is it bad? And they think about it and they say, no, I'm not doing it every day. And it's what I needed in that time. I'm like, okay, well then it's not an unhealthy coping strategy for you because for you it worked. Um, some people do struggle with coping strategies that, when they reflect, are not in alignment with their values and their goals and the lifestyle they wish to have. And there is help out there to help you if that's a coping strategy that you're using and you're having a hard time shifting away from that. But it is not appropriate for me or anyone else, in my opinion, to tell you what is or isn't an okay strategy for you. If you are living a life that aligns with your values, then I am never going to judge you. All right. Also want to talk about coping strategies or suggestions that might be unhelpful. I find these come up a lot from well-intentioned, caring people. And I will summarize these into a category where you ask yourself, does your coping strategy validate your experience? And what I mean by that is, does your coping strategy help you acknowledge or acknowledge for you that what you're experiencing is real? Um, and let me give you some examples of ones that often come up and are not super duper helpful. People tell you to smile, cheer up, it's okay. It's not validating to how hard what you are experiencing right now truly is. When people suggest, or when you suggest to yourself, I need to be grateful. And I hear this one so often. I need to be grateful that I got a transplant, and so I shouldn't worry that my transplant won't keep working for a long time. I need to be grateful that I'm 50 years old and haven't needed dialysis yet, and therefore I shouldn't worry that one day I will. I hear this a lot from cancer survivors. I should be grateful that my cancer is in remission, and therefore I shouldn't worry that it might come back. Gratitude is lovely, but if you are using it in a way that gaslights yourself and tells you you shouldn't be thinking something that you clearly are thinking and feeling, then it's not a helpful strategy. The strategy is only helpful if it also validates your experience. Telling you to be grateful instead of what you are feeling and thinking may come from a place of good intention and compassion, but it is likely not a helpful strategy for you. This is another one. You got this. You don't worry because you got this. And you might be really scared about very real things, very real dangers that exist as part of your illness. To tell you that you've got this, to tell you you will be okay, when there is a part of your brain that might be small and might be really big and loud telling you, but maybe you don't, is well-intentioned but not helpful. Telling you not to worry about it because you've got this and you will be okay is invalidating what you know to be true. It's invalidating your true experience. And this is one that I have to be honest, therapists are sometimes guilty of. We need to breathe. If you are stressed out, you need to breathe, and that will help you. Now, I will say, I do use deep breathing techniques with my clients. I only do it in the context where we have also acknowledged the fear, the stress, the worry about what that person is dealing with. Breathing should never take away or never attempt to take away your worry. It should serve only to help your breathing and calm your nervous system, not to make the worry go away. Because your worry is real. Okay? This is not a disproportionate fear. It's not anxiety that you've made up and couldn't actually happen. Every single person I've spoken to, I mean, it's possible that some people are worried about things that are not at all realistic. I will say that in my practice, I've never actually met somebody who does that. That every single person in my practice who is worried or anxious about their health or anything else for that matter is worried about something that is very real. So if we're going to work on breathing, it's not to make the worry go away. Any strategy whose intention it is to make your worry go away is in a way invalidating your true experience. So breathing is lovely, depending on how you're using it. All right. If you don't know me yet, that's okay. You'll see that I'm very, very passionate about certain things. And, I'm always grateful for people to listen and share my perspective and hear my point of view on things. And for any presentation that I give, any information that I share, I always tell people take from this what feels right for you, what feels validating for you, what feels helpful for you, and leave the rest. Right? One of those first slides about identity, that we are all different. Of course, we're all different. If this doesn't all work for you, that's okay. You do what feels right for you. All right, so here, my 2 cents for what it's worth, and rooted in some research as well, are some things that you might choose to do instead to help honor the uncertainty of your future, to help honor your worries that come into your present, that are impacting your present, and to help bring some peace and comfort and calm to a present that acknowledges that the future is uncertain. It's not a don't worry, be happy solution. It's not a wave a magic wand and make your worries go away. It's how do we allow yourself to experience joy while your worries still exist. I really like this activity. I do have it as printable. And I often invite people to color it in. It is a ball of emotions. And it literally just has all kinds of different emotions labeled in there. And you can think about how many of those emotions are you experiencing right now. There's a lot more to the activity. But for the purpose of today, I want to actually do this for myself. If you feel like you want to do it as well, you can. Um, but I will share that right now, at this moment, I am feeling inspired by the opportunity to share with all of you folks. And I'm feeling gratitude for having been invited and welcome to do that. I am feeling a teeny bit nervous because I always do whenever I speak to people. I'm feeling tired because I am an adult who has adult responsibilities, and sometimes I'm tired. And all of these emotions and sensations are coexisting in me at the same time. I'm not going to push away my tiredness or my nervousness. I'm simply acknowledging that they are here with me right now. And truly, I would invite you to consider the same. If it feels safe and comfortable for you, get to know your feelings. Get to know your worry. Get to know your fear. Take the time to look inside yourself. Notice if it feels right for you. And, this isn't something you have to do alone, but you can if it feels okay. Um, Notice what that fear or worry feels like in your body. Notice what the thoughts are that are coming up. Notice how the thoughts impact the sensations that you're experiencing. And then, if you want to get a little bit meta, which is why I have this picture of a mirror, notice yourself noticing. Step back and say, oh, I just noticed that I'm scared. I just noticed that I don't like that feeling of being scared. I just noticed myself try to push it away, and I'm remembering that Joy said, maybe I don't need to push it away. I just noticed myself feeling guilty about being scared because I feel like I shouldn't be so worried and scared all the time. This is a very high level way to think about our emotions, not just in and of themselves, but also being like that we can have thoughts and feelings about our thoughts and feelings. Um, and it is actually a coping strategy. There's interesting research that supports it as a coping strategy. And one type of therapy, acceptance and commitment therapy, leans into that very, very much to say it's helpful, not just important, but actually helpful to get to know my feelings, to get to know my thoughts and feelings about my thoughts and feelings, and to allow myself or invite myself to be okay with my thoughts and feelings as they are without trying to push them or change them. One feeling that is arguably especially important for us to get to know when we think about uncertainty, when we think about fear, when we think about anxiety about the future, is to think about fear as our protector. Our fear is telling us something. It's saying, I'm worried about the future and I need to take control to make this better. It is working really, really hard to make your future better. And so when you try to push your fear away, you're actually very actively trying to push an important protective part of you outside of you. You're trying to ignore that part of you that's trying to help. Now, sometimes, maybe often, that protector is so loud and so powerful that it makes it really hard for you to enjoy the present. And I don't want to minimize that. So, our question and our one of the things that I do a lot in work with my clients is to explore how can we honor that protector and allow you to find joy in your day-to-day life right now, knowing that your protector is working so hard to keep you safe in the future as well. I'd also like you to consider that your fear is or might be doing a lot of time traveling It might be looking into the future. It might be looking a short distance into the future or a very long distance into the future. What if this happens? And if this happens, then what if that happens? And if that happens, then what if this next thing happens? And if that happens, what if the next thing happens? And some people might refer to that as time traveling. This is not a bad thing to be doing. It's an important thing to be doing. It's how we prepare for life. It is part of adulting. It is why we write wills. Like this is an important and real thing. I'm not asking you to stop. I'm asking you to notice. Notice that it's happening if that feels right for you. Because when you notice your thoughts and feelings and you make space for them and you honor them, that actually helps them. I'd be remiss if we didn't talk at least a little bit about circles of control. This is a theory that's been around for a very long time, and it is informative, but it is not the be all and end all of anything. Um, so in life, if you haven't heard this before, or if you have, I'm going to go through it pretty quickly. In life, there are some things that are within our control. And in PKD, as much as it may be hard to imagine, there actually are some things that are within our control. You can choose to attend your appointments. You can choose to take your medications as prescribed. You can choose to attend webinars like this one. You can choose to read books or not read books. You can choose to read websites or not read websites. You can choose to attend meetings or not attend meetings. These are things that are absolutely within your control. They may be hard to do for a lot of different reasons. And perhaps I've made sort of a broad brush strokes. For some people, some of those things might not be in your control. There might be barriers around them. But by and large, if you look at your own story and your own situation, there will be some things that you are able to control. The next circle outside of that is things that you don't have direct control over, but you have influence on. And I'll give you an example in my story is when it came time for my husband to make decisions around dialysis and transplantation. He was very clear that he wanted to have a living kidney donor transplant for a lot of reasons. He was very young and his prognosis was very good, and the research supported that, and so on and so forth. Now, we can't actually control whether or not he has a living kidney donor transplant, but we can influence that by doing things that are within our control. And in our case, that meant sharing his story very widely. And so by choosing something within our control, we created social media, we spoke to mainstream media, he was in the newspapers, he was on a TV channel at one point, we had a Facebook page, and so on and so forth. We gave influence to our ability to reach more potential living donors by making choices that were within our control. And then there are the things that are outside of our control. And those are really, really challenging because we want so much to have some control over them. And so, for example, one thing that comes off is the speed of the disease progression. It's largely outside of our control. We do have some influence over it, and there's some really interesting research happening around GnRH and diet and, exercise and other things that might influence that. But at the end of the day, there are some things that are truly outside of our control. And so often when we talk about circles of control, we're like, well, the outside circle you have to accept. And it's like, well, I'm not prepared to accept that. Well, fair. You don't need to accept it. You don't, and no one can no, and you can't just wave a magic wand and be like, well, you just need to accept it, and that's how it's gonna be. The only thing that you need to accept, in my opinion, is that there exists some things that are outside of your control. You don't need to accept those things. You just need to accept the knowledge that they can't actually be within your control. And I don't know if that's making sense right now. Um, and so I'm going to leave it for now, except to say that, the field in general says that some things are outside of your control and really your only option is acceptance. And I'm like, but I know from my own personal experience that accepting it is not something that comes easily or sometimes at all, and sometimes just feels wrong. Um, One thing that is within our control is not where our thoughts go. Our thoughts are going to go where they're going to go. But one thing that is within our control is how we spend our time. So my thoughts are going to wander. My thoughts are going to time travel. My feelings are going to feel all over the place. But I have control to say that today I'm going to show up at a webinar and learn more about my mental health and uncertainty and PKD. I'm going to choose to spend my time here. And my thoughts are going to do what they're going to do. And that's okay because that's a normal part of the human existence. I talk a lot with my clients about their values. Because when we think about what we can and cannot control, I find that people feel some solace, some peace in the directions and decisions they've made in life right now when they use their values to guide their decisions right now. So you will always have uncertainty about your future. And, you've heard me talk at length about why I think instead of trying to do away with those uncertainties, to acknowledge that they exist and to make space for them, you don't need to push them away, but your life will feel better if you are able to make decisions in the present that are led by your values. So, for example, if you're post-transplant and you're really worried about what the future of that transplant might be, and you know that there's so many factors that might influence that, but right now it's really important to you to spend time with your family, and you choose to spend time with your family knowing that it may influence your future, you are living a life within your values, and that's important. I find this comes up a lot actually when people are contemplating transplant, because a lot of people have, as they come closer and closer to needing a transplant, they do a lot of reflecting on what their values around a transplant are, what their values around asking for a living kidney donation, or what their values are around transplant in general. If you are making your decisions in alignment with your values, there's a lot of research that shows that that will bring you peace, even in a life of uncertainty. You also want to think about anchoring yourself in the present. So your worries are really bringing the future into your present. Part of coping with uncertainty is bringing yourself back to your present. So your values bring you back to your present, and then anchoring can also bring you back to your present. And anchoring comes in a lot of different shapes and forms, but essentially what it means is doing something that feels very here and now. For some people, that's a routine, that I wake up and I go to work every day, that I wake up and I brush my teeth every day can be an anchor. Something that brings you back to here and now is an anchor. That I go outside and take a few deep breaths in nature to smell the season is an anchor. To sit on my sofa and pet my dog is an anchor. It brings me to here and now. And so if you notice, yes, my worries still exist. My thoughts for the future still exist, and I am anchoring myself in something that brings me to right this moment right now. Mindfulness is something that I have talked about quite extensively in a previous presentation, so I'm not going to get into it in any great detail today, except to say that it is one of the quintessential examples of anchoring. Because the entire point of mindfulness is to become very present in what you're interacting with at that exact moment. And there are lots and lots of excellent resources and presentations that talk about mindfulness in great detail. And if you look at last year's PKD Summit presentation that I did, there's a whole section in there that's specific to PKD and mindfulness. Um, Sometimes deep breathing is part of mindfulness, sometimes different exercises within your body are part of mindfulness. And then I also incorporate, like, how do you think about chronic pain and mindfulness? Because if I'm inviting people to do deep breathing, but that is going to physically be uncomfortable because of the size of their kidneys, then that's not actually helping in the way that we hope that it would. Um, and so, yeah, like I said, I'm not going to get into a lot of detail about that now, but just wanted to bring it up here because it's relevant. Another, truly another anchoring tool, but also another coping tool in general, and one that is very much within your control, is to create connections because you are not the only one dealing with this uncertainty. It feels so heavy to cope with this alone, to cope with it even in your immediate family, because each person in your immediate family is feeling so differently about it. I do want to point you in the direction of some amazing resources that the PKD Foundation has in this regard. My PKD is an online support presence, and Mind Matters is regular meetings that they have virtually for people to attend from all over Canada. And in both cases, they are really beautiful ways to connect with other people with shared experiences, with shared worries, with shared fears, with shared uncertainties. And knowing that you're not alone is something that is within your control. Doesn't make the worry go away. But I hear over and over again that it makes it a little bit easier to carry. There are other spaces as well where you can connect with other people. Different social media platforms have groups. Um, Kidney Foundation has groups. There are lots of other spaces for that too, but I wanted to point you to some important ones here within this organization. And then I'd be remiss if I didn't at least talk about therapy as an option that exists. Um, Therapy, there are a lot of different ways to do therapy. And so um, I want to tell you a little bit about me and my style, but I also want to acknowledge that my style is not for everybody and that therapy is not for everybody. Not everybody needs therapy, not everybody wants therapy, and not everybody can access therapy. But I did want to let you know that for some people, it is a really important tool, especially in coping with uncertainty and fear about the future, when you find that those fears are so, so big, so overwhelming that it makes it feel impossible to enjoy the present. And I remember speaking to somebody recently, um, and she decided to attend therapy after a major medical challenge that she was experiencing. And she said, it's not normal for me to not be able to have fun and joy, and I want to enjoy my life with my children, and it's not normal that I can't. And I said, actually, it's completely normal that you're struggling with this because you've had this major, major medical crisis, and it's impacting your body and your thoughts and your feelings. And so it is normal that this is hard. If this was easy, I would be confused. If you were having a walk in the park right now, I'd be confused. This makes sense. And so sometimes therapy is validating your experience. Sometimes therapy is about giving you a chance to talk about the stuff that you can't talk about with other people. Because when you start sharing it with your immediate family, all of a sudden they're worried and you're comforting them instead of them comforting you. Therapy can be about teaching you and helping you figure out what are the mindfulness or anchoring or grounding exercises that feel right for you. The exercises that don't invalidate your worries, the exercises that acknowledge and make space for your chronic pain and don't exacerbate them. Um, Therapy can be about helping you to find a way to let those feelings coexist. Because I come in here and I talk about, like, well, you need to let your joy and your frustration and your fears coexist because you can have multiple feelings at the same time. And it's like, okay, thank you very much, Joy, for stating that as if it's some kind of fact. I still can't do it because the fear feels like it covers over everything else. I'm like, yeah, of course it does. Because what you're dealing with is big. So for me to come in and say it, and then even for me to go on my own time and do it, like it's not as easy as I make it sound. And I want to acknowledge that. It's not a thing that just happens. Sometimes working with a professional um, can help make that from an idea that you'd like to do to something that becomes over time a little bit more attainable to do. All right. I think I'm done with my telling you my 2 cents about things. If you leave here today, um, feeling like the uncertainty and perhaps fear about your future is valid, that it is okay to have those emotions, then I feel like I've really done my job here today. If you feel like it's okay to acknowledge those feelings and try to focus your time, not your thoughts and your feelings, but focus your time and your actions on the things that you can influence and the things that you can control. And that if perhaps you're inspired to anchor yourself in what matters most to you, to anchor yourself in the present and to make choices based on your values, to know that, no matter what uncertainty lays ahead, that you can feel good about what you're doing right now. Then I hope that feels like it's been a helpful use of your time this afternoon. Truly, thank you so much to Michelle for organizing, to the PKD Foundation for hosting. It is always an incredible honor to be included in this summit. It's an amazing organization. If anybody ever wants to learn more about me and my practice, I've left some information on the screen for you. My website is www.findjoy.ca. My email address is joy@findjoy.ca, and you can also follow me on Instagram at findjoy psychotherapy. It's just a little snapshot of me doing some of my own grounding, and I love coloring for grounding. It's a very calming exercise for me, but I know it's not for everyone. And yeah, truly, thank you. I'll stay for any questions that might come up. That's that.
Thank you so much, Joy. And as she mentioned, we have some time to answer some questions now. And because we don't have a session following this one, we are able to maybe address a few more questions that we might not have been able to. So please, if you do have a question for Joy, feel free to put it in the chat or in the Q&A, and we will try and get to it. I know I have something I can ask Joy right now. It's something I often hear from PKD patients, especially women, especially if they're in a later stage where they've got PKD belly, is they find it really draining to have to deal with people's unwanted questions or assumptions,
Mhm.
and to the point where they almost don't even want to explain anything because even that would take too long and maybe reveal too much about their health that they'd rather keep private. Um, can you talk a little bit about, ways that people can deal with unhelpful suggestions or comments?
Yes. This is something that comes up a lot, is not just specific to PKD, certainly a lot in PKD, but in general, when people make comments that are so unwanted and off point and throw you off guard, I find is also really, really unsettling. Um, the fact that this one comes up a lot in PKD means that you can arm yourself with a plan. Um, so I think each person needs to think for themselves about their own values around this. Some people's values might be, I am okay doing self-disclosure to use this as a teaching opportunity for other people. and say, no, I'm not pregnant. I have polycystic kidney disease. My kidneys are the size of footballs, and that's why my abdomen is the size that it is. Other people are not comfortable doing that level of self-disclosure in the grocery store aisle. Like, really, why people think it's appropriate, uh, it is beyond me. So some people will respond and they'll have thought about it ahead of time and say something to the effect of, "No, I'm not pregnant. Do I look fat?" It's snarky. And some people would say, "No, that doesn't align with my values. I would feel like I'm being too mean." Um, some people might have a t-shirt on that does the talking for them, and some people might choose to answer and say, "That's an odd question to ask," or "Why do you ask?" To answer a question with a question invites the asker to reflect on why do they even think they want to know that. To just say, "Oh, that's a strange comment," or "That's an interesting comment." Other people's comments are one of those things that are not within your control. You can influence them. So if we're going back to circles of control, by doing something very visual in advance, like wearing a shirt that says "I'm not pregnant, I have PKD," or by choosing not to go out to busy places where people are likely to ask stupid questions. Um, I'm trying to think if there are other things you can do to influence. There's very little, really, that you can do in terms of influence. Um, And so it begs the question, what aligns with your values? And that's why in decision making, I always bring it back to values. What aligns with your values? And if you can only conceptualize or imagine two or three options, then maybe what you need is a brainstorm session, because odds are there are more options of what you could do or how you could respond. So, and then your response is something that is within your control. And you might say, "Look, I have two response options. If I've got the energy and capacity, then my response is, I'm not pregnant. I have polycystic kidney disease. Can I tell you about it?" And if I don't have energy, my response is, "That's a strange comment. Why do you ask?" Because that'll shut people down real fast. And if I really don't have energy, then maybe I just don't leave the house today. And if that aligns with my values right now, then it's a healthy coping strategy for right now. Just check your own values all the time to guide your decisions. Does that feel helpful?
Yeah, thank you very much for sharing that. We've had someone in the comments say they're in the middle of a workup right now for a preemptive transplant, and their EGFR has just improved. It's just gone up. And for people who maybe don't know the context, usually the nephrologist won't consider a transplant until your EGFR is at 15. So this person says, why am I disappointed that my kidney function has gone up?
This makes perfect sense to me, right? So why are you disappointed? Because in theory, improved kidney function should be something to celebrate. But in practice, and I don't know you, and all I know is what you've shared in the screen. So I'm sort of internalizing this to how I would feel if I was in that situation. And so if I'm off base, then I'm off base. But my gut is telling me that it makes sense to be disappointed because you had a plan, you had a level of predictability and reliability about what the next few months holds for you. You had a sense of security and that knowledge of what's going to happen this day and this day and this day and this day, even if there's still a lot of questions, obviously, but you had a direction that made sense. Something was certain and now it's uncertain. Something was planned and now it's unplanned. And that is really unsettling. Not to mention the fact that odds are, if you were sort of teetering at the ready to get ready for transplant versus not quite ready to get ready for transplant, then it's not like the doctors are predicting that you're never going to need a transplant and isn't it great your PKD is cured. Odds are the doctors are predicting that it's going to be delayed. And so now your plans have been turned upside down. Plans being turned upside down being a disappointing experience makes perfect sense to me. So I don't know if what I've guessed is in alignment with what you're feeling because each person is different and I'm projecting a little bit in terms of, and if you were in a session with me, we would talk a lot more about sort of, you know what, first off, I should backtrack. Good for you for noticing that you are feeling disappointment in a scenario where some people might see that as good news. Good for you for having that introspection and pause and saying, I'm noticing that I'm feeling this way, and I'm wondering why I'm feeling this way. And if we were in a session together, we would unpack that in much more depth and really obviously focus on your experience. But having you share that here, I'm so grateful you shared it here. I've taken a stab at why I think you might feel that way. And yeah, thank you for sharing.
The same person followed up with a comment to say to themselves, and they appear to be managing the uncertainty, complexity as well as they can. However, when they fall asleep, they wake up soon afterwards with a profound sense of doom. Is that probably acute anxiety that they've uncovered?
Okay. One thing that I didn't get into in this presentation, um, and so I'm especially glad that you asked about it, is our body's physical response to stress. Difficulty sleeping, changes in appetite, um, changes in concentration are all very normal responses to experiencing stressors. They are also very normal responses to having decreasing kidney function. So when people ask me, is this my PKD or is this anxiety or is it stress or is it something else? The answer is I don't know. I don't actually know you, and so I could never make an assumption on that based on, an interaction in a chat. Um, but also, it's possible that nobody could ever know for sure. It's possible that that's part of the uncertainty in all of this is our changes in sleep and feelings of doom and fear part of PKD itself? Are they part of very, very normal fear and stress about the future? Um, is there an element of anxiety that goes over and above what would make sense in your situation? It almost seems impossible to tweeze that out, even in a scenario where we know each other really, really well. And definitely impossible in the context of this Q&A. But I'm truly grateful that you shared that. Um, and I do want to sort of normalize the fact that stress does impact our body as well as our thoughts and feelings. That is a very normal part of stress, and being at this stage of PKD is very stressful, period. So yeah.
Thanks so much. There's a question in the Q&A area. Someone's saying, how do you handle a friend who continually says, you'll be fine, everything will work out, don't worry? And they go on to explain their situation. They're waiting for a transplant and on dialysis at the moment. And these feelings are real for us, and we find these comments aren't helpful, but we know the friend means well.
Yeah, I fit that into the second category, the unhelpful suggestions. And it sounds like you're experiencing that loud and clear. It sounds like you've identified it as, somebody who means well and does not understand at all. I think every single person here probably has a story that is similar to that. We all have that person in our life who means well and says something that's way off base. I remember at a holiday dinner when my husband was in the stages leading up to transplant and dialysis and like clearly very much in kidney failure. And a relative said, "Well, isn't there a supplement you can take? 'Cause there must be a supplement, like really." And the answer is clearly no. And I would lean into your values once again because your friend's actions are outside of your control, but they might be within your influence. So You may decide if it feels right for you, if you have the energy and capacity, and if it aligns with your values, to say, look, we need to talk. This is the state of my health. Here are some websites that will give you more information. When you say, don't worry, it's going to be okay, it makes me feel like this. So please don't say that anymore. Here are things you can say instead. Those conversations are hard. They take a lot of work and they take a lot of energy, and not everybody wants to have them with every person in their life. So, other options, and again, you need to figure out within yourself what aligns with your values. Some examples of other options are have fewer interactions with this person, have interactions that are more structured, so they're less likely to come up. Um, Allow the statements to happen knowing that they will and just ignore them. All of these are options. And whenever I tell people you've got options, you always have more options. You can ask somebody else. Like if there's somebody else within your circle of friends, you can ask another friend to say, hey, can you talk to so and so because they're really not getting it and it's kind of exhausting hearing their bad advice over and over, even though I know they mean well. So there's always more options to consider. Think about the option that aligns best with your values to be able to guide you on that one.
Thanks so much for that, Joy. We have a comment in the chat. This is not so much a question, but just sort of sharing the person's own experience. They had a small child ask their mom, "Is that lady pregnant?" And this PKD patient says, "I just felt bad because it's the first time I'd had this happen. I didn't have the ability to answer because it wasn't directed at me, but rather at her. I just got out of the store I was in."
I'm sorry that happened. Um, and when these things happen, it impacts each person differently. Some people brush it off. Some people, it stays with them as a humorous anecdote. Some people, it with them as something that feels quite heavy. Some people need to share it and talk about it. Some people talk about it with their immediate family or close friends. Others find that to be less helpful and they save up their stories to share with me in session of like, you wouldn't believe what happened in the grocery store. Because they know that I will approach them in a way that is non-judgmental and supportive. Um, but I appreciate you sharing it. I have no doubt that there are other people here who have had similar uh, situations in one way or another, that people make comments and then you don't have a choice but to just, you're going to react how you react and give yourself grace and compassion for whatever reaction you have to that.
Thanks, Joy. I just want to check in. I have a couple more questions, but are we good for time? Do you need to get
I'm
away?
okay. Yes, I'm okay.
Um, we had a question come in with the registration. Someone's asking, will we forever worry about losing our new kidney?
I'm so sorry. It's fall and I have a little sniffle. Um, so the question is, will we forever worry, and this is specific obviously to people who have had a transplant, will we forever worry about losing our new kidney? I would say probably yes. I would say that's probably a very normal thing. Because remember, fear is your protector. And because your doctors have told you that you need to protect that kidney. Because if you don't protect that kidney, then it you'll reject it. You need to protect it by taking the medications as prescribed. So every time you take your medications as prescribed, a tiny part of your brain says, I'm taking these medications to protect my kidney because if I don't, my body will reject it, and that's why I take them. So will you forever have that as part of what happens in your brain? Yes, because your fear is your protector. And it's good to have it. Because if you didn't have it, you wouldn't be taking good care of your kidney. And so it begs the question, not will you forever worry about it, but instead, how do I live a rich and meaningful life while my protector is looking after my kidney? How do I live a rich and meaningful life where my protector does not take over my ability to find joy right now because it is worrying about the future? How do you look at your ball of emotions and allow those things to coexist? Because if you weren't worried about losing your kidney, I think that would be a bigger concern for your nephrologist.
Thanks so much, Joy. We've had another question in the Q&A area. Someone's asking, do you know if there are any good supports for children with AD-PKD? My kid was born with and affected with PKD since they were born.
I think that's a fantastic question. I don't know of anything specific, and so I'll throw it back to Michelle to see if you have any insights on that.
We aren't aware of anything right now, but certainly as I'm planning sessions, learning events for 2026, one thing that a few parents have already brought up is they would love to see more about supporting families with young children who have PKD, whether it's AR-PKD or AD-PKD, and it seems to be a gap right now. So I would say, absolutely look for events that we're going to be having in the future. But also, if you wanted to reach out to us on your own, you can email us anytime, and we're always happy to help people explore options and find resources. So thank you for that question. And I have one more that came in with registration. Somebody asked, I feel worried as I am getting older and my kidneys potentially needing dialysis. Got two young kids and a wife who has her own health challenges. I often feel like and I'm the support person my whole family leans on. What will happen when I need dialysis?
Um, that is a story that extremely relatable. Yeah, I your fears are real. Your fears are valid, is really all I can say to that. Those questions are important and those questions make sense. And the uncertainty that exists in PKD is not just a medical uncertainty. It has to do with your whole family. It has to do with your finances. It has to do with your whole life. And for me to come in here and say, well, you just have to focus on the things within your control is almost patronizing in a situation like that because those are not small and not unlikely. They are very, very real and genuine and important concerns. I hope that if that person is watching today, that they felt validated by hearing the presentation and that they felt, uh, you know, perhaps informed on small ways to manage that uncertainty. And I hope first and foremost that they don't feel that any of that certainty has been minimized in any way, because there's nothing that I could say that I would feel okay with saying that would minimize your concerns because they are real and valid and important just as they are.
Thanks, Joy. Well, I don't see anything else, and I want to thank everyone for their questions and comments, and I would especially like to thank Joy for her participation in today's presentation. We frequently get all sorts of mental health questions through the foundation, and it's really wonderful to have a library of resources that we can point people to. And I hope that people have found this session very helpful. I know it's answered the questions that we as the foundation wanted to have answered or dealt with. But we just so appreciate you, Joy. I want to let people know that this session has been recorded. It will be available on our YouTube channel in the coming weeks, and everyone who is registered will receive an email once the video is available. And I'd also like to reiterate, as I did with the parent who's asking about their child with AD-PKD, if you have additional questions that you would like us to ask Joy or any questions about resources that are available, please feel free to email us anytime at endpkd@npkd.ca. I've put the email address in the chat. Another thing that we are always happy to do is, at the very least, connect people with others in a similar situation, because that part of community that, or reaching out and for connection that Joy mentioned. And we have many members of our community who are really open to speaking with anyone. So we are happy to facilitate that for everyone as well. Having said that, thank you, Joy, and goodbye, everyone.